Hello, everybody, and welcome to another session of dental shadowing. Today we have Dr. Gaj with us. He's a general dentist, and he's also going to be talking to us about mental health and dentistry. So welcome, Dr. Gaj, and you can take it away.
Hi, guys. My name is Dr. Gaj. Thanks for joining. I'm really happy to be able to do this. I'm sorry you guys can't shadow as much, but hopefully these have been helping. I've done 2 in the past and they've been pretty cool to do. And when I was in your shoes, I kind of wish I had this, but obviously I'm older now, so we never had this opportunity. I just kind of went off student doctor network. So hopefully this helps. I know a lot of dentists in the past, kind of like, or the stuff you guys have gone over, they typically focus on the dental aspect of things, which is great, but I think it's important to also kind of address like mental health in our profession and also in the pre-dental profession, because you guys go through so much stress starting from high school onwards. So I want to go over that, and then just to kind of go back to dentistry, I will go over a case with you guys, just because I'm sure some of you guys do want to see what we go through on a daily basis and whatnot. So yeah, let's go ahead and get started. So I'm currently a dentist practicing at this place called General Dentistry in Austin, Texas. I graduated from Midwestern Illinois. And yeah, I've been practicing for 2 years now. So I'm pretty fresh in the whole field, but I've had enough experience to kind of know what I like and what I don't like. So yeah, hopefully this all helps. So mental health and dentistry. The main thing I want to kind of go over first is just when you do start off in the field, you want to start off by choosing the right school for you. So a lot of people kind of go for school based on their location or, in-state versus out-of-state, which I totally understand from a financial perspective. But another thing I want you guys to consider is also, a mental health perspective. Like, where will you be happy and most satisfied practice or going through school? So I ended up picking Midwestern because I had 3 options, and I felt that Chicago just seemed like a state that I really wanted, or just like a city I really wanted to be in. And Illinois as a state isn't anything amazing, but as a kid I always grew up watching movies like Home Alone and all these other stuff. So I really loved the city of Chicago, and so I ended up picking the school not only for the school but also for the city it was in. So that's something I want you to kind of take into consideration when you are picking your school. Like, think about the amount of free time you're going to have outside of school and where you want to be when you're spending that free time. The other thing I want to kind of go over is reflection. So just take moments through every step of your dental career just to kind of take a step back and just appreciate what you've been through, because it's a hard field, it's a hard profession, it's super competitive, and you guys have gone through a lot already. And I think we get so motivated on the next goal that we forget about the goal that we've already accomplished. So just take moments to kind of reflect and treat yourself, and, congratulate yourself on getting through things like, passing the real DAT, just doing well on certain aspects of it. I think it's important. Like, even right now, the fact that you're doing this is awesome. You're a step ahead of so many people who aren't trying to learn more about dentistry, or not trying to do the extra steps that you guys are doing. So definitely take a moment to reflect and congratulate yourself on that, because that's a huge thing. Mental health from pre-dent to DMD, DDS. So that's just the same thing I've kind of reiterated. Just kind of keep in mind that physical health is important, especially in dentistry, like your back and your neck and everything. But your mental health is just as important. If you overwork yourself, or if you burn yourself out, it's not only going to be detrimental to you, it's going to be detrimental to your patients. It's going to be detrimental to your practice, and it's going to affect everything in your dental field. So don't just think that oh, I can just work through everything and I'll be fine, because it'll actually cause everything to have a downward slope. So just keep that in mind. The other thing is finding balance. So going to dental school, I think that's when I kind of learned how to really find a balance, because Yeah, it is, challenging, but I feel like you still have a lot of leeway. And I think we do get a little spoiled in undergrad just because you have so much free time to yourself. Whereas in dental school, there's no real off time. Like even when you're done with class, you're still studying for something and you're still preparing for the next patient or exam or boards. So in that amount of work, you just have to find some time to do stuff for yourself because it's gonna, like I said, if you overwork yourself and burn yourself out, it's just gonna affect your grades. It's gonna affect everything. So what I did was I would spend like every weekend I would make a effort to go to the city and explore the city. And I'm really into photography, so I would force myself to go and like take photos and just like enjoy myself while I was in Chicago. So that's something I want you guys to also remember is just like find a balance, find stuff that you're really passionate about and you love doing outside of the dental field and try to enjoy that aspect of it. So that was another thing. And then next thing I'm going to go over is a case discussion just to kind of balance this all out. In terms of education, I graduated from University of Texas here in Austin. Did bio and business. You can do any major. There's no like perfect thing to do. Just do something that makes you happy because obviously when you go into dental school, you will be doing a lot of science, a lot of chemistry, a lot of bio, chem, stuff like that. So just keep in mind that if you don't like doing that right now, then don't force yourself to do that in undergrad. You will be required to take the core recs, but outside of that, if you really love film, you can take some film courses. If you really love music, take some music courses. Because not only will that help you as a student, but it'll actually look good on your resume because they also like well-rounded students, obviously. So it would be nice to stand out as opposed to like there are 50,000 other applicants that have bio as their thing. And I know it's kind of ironic because I have that, but it's because I actually did enjoy that. And I think like if you do genuinely enjoy that, then you excel in it, then like take advantage of that. So the reason I chose Midwestern, I already told you location. The other reason was the tech. So I really liked that they had up-to-date dental tech. So they had like, a lot of the CAD CAM machines. They had all of their operatories were pretty up to date and they used a lot of like the newest software for their stuff. So I really like that because the way I saw it coming from a tech background was that if I go into dentistry, I really want to be kind of in that like um, leading dentist field of trying the newest tech, trying the newest stuff. So I thought it'd be cool to have like that upper hand coming out of it and knowing how to use some of the stuff that's already out right now. And I did work at the Genius Bar at Apple before I got into dental school. When I worked there, I just kind of built a passion for tech and all that kind of stuff. So it really helped me just kind of appreciate that aspect of it. And that's honestly the future of dentistry. That's going to go very much tech. So I think if you guys are really into that, or if you really are into coding or anything like that, that's something to definitely consider bringing into the dental field because I think that's going to be the future. General dentistry. So I currently practice general and cosmetic dentistry in Austin. I recently moved to a private practice. I used to work in a lower income in Houston, Texas, and I moved here just about a month ago now. So I'm still transitioning to this different kind of dental field, but I love it. I ended up being lucky in finding an amazing practice with an amazing owner, two amazing owners, and they've been nothing but great with kind of like mentoring me through the whole process. I wanted to grow more as a dentist. So I think the thing about dentistry that's amazing is you don't really ever need to settle. Like you can always do something else if you get tired of it. So there's so many aspects of dentistry you can do. So if you want to do on more cosmetic dentistry, you can find that. If you want to do more lower income helping the community dentistry, you can do that. And there's no like end game. You can always figure out what your next chapter is. And so for me, I just never wanted to get too comfortable. I always like to kind of push myself. And I reached a point at this lower income office where I was getting super comfortable and I wasn't challenging myself. So I kind of decided to kind of take that next step and try something different and kind of go more into the cosmetic end, because I've always really liked the cosmetic aspect of dentistry. And I think I love Austin, so I always wanted to move here ultimately. So that was my decision. Um, why I picked this practice. I picked it based on the reputation of the owners, the mindset, and the attitudes. It all aligned with me. That's something you guys should always consider. When you do get into the field of dentistry, you always want to work with people that you admire, respect, and want to work with. Don't ever pick something just because it was a available option, or because the pay grade was good, or because there was a monetary reward. I mean, I think like when you get out of dental school, unfortunately, it's not as easy to just join any private practice. You need some experience. It's a little bit more competitive. But even if you do pick corporate or anything like that, just make sure it's a corporate structure that you agree with, like their motto, their attitude towards patients, stuff like that. Because if you join that practice and you don't agree with it, unfortunately, you're stuck with them under a contract or whatever, and it can definitely it can realign your attitude, and it can also kind of brainwash you in a way and affect your treatment planning process. And that's not something that, if you're thinking a certain way and then you join something that doesn't align with you, you might start thinking that way. And to me, that's like a nightmare, because I never want my personal ethics and treatment planning to redirect itself based on someone else's treatment planning style. So I joined this practice because they give me full reign to do whatever I want to do, but they trust me and they know that what I'm doing is within my best, within the patient's best interest, not just mine. So that's what was the main driving factor for me. So these are all the main factors I want you to consider when you are applying. You can definitely save this or screenshot or whatever. I also had like a little, it was kind of like a PowerPoint I made. So like I had questions I would ask every practice when I would go for the interviews. And I think that's important to have, is just like a list of questions when you do go for your dental interviews, because once you graduate dental school and you go trying to find a job, you have to realize not only are they interviewing you for the job, but you're also kind of interviewing them to see if you're a good fit for them. So that's, I know this is far from where you guys are, but it's something to always keep in the back of your head. So hopefully that helps. My day in the life of a dentist. So just to kind of give you an idea of what I go through now at this new office. So typical day, you start with the morning huddle. Then that's where everybody gets together, the assistants, hygienists, the staff, and we kind of go over the schedule for the day. We meet like 15 minutes before the day starts. We discuss any cases in the past with the staff, or any opportunities for improvement, anything that happened the day before, maybe that's worth bringing up. Or even congratulate people who did well, like the hygienist, the other dentist, anything like that. Once I'm done with that, I try to go to my office and I call any patients that I did treatments on the day before. I try to make it a habit to always call patients after I did a crown or extraction, just to see how they're doing. Because I think just a small thing like that goes a long way. Just, for a patient to know that the doctor's calling them the next day to follow up on them and see how they're doing. It's a big thing. And it's like small touches like that that'll really drive you a long way in dentistry. Sorry if my voice is like super dead. I'm just like, I've been talking all day. So for after that, I do like to review my schedule, change codes, update providers, anything like that. The one thing you'll notice about dentistry is like attention to detail is super important, not only in the fillings you do and everything like that, but also in your patient charts and everything. You want to make sure you're fully up to date and backed up on everything like that, because if anything ever happens legally, or if you ever get into any legal disputes or anything with your patients, you always want to have notes on everything. So you always want to have like detailed information on everything that's happened, the right codes and everything like that. So it's very important in dentistry to like be on top of that kind of stuff. After that, I review all the medical history, information about patients, new patients, upcoming patients. Again, you want to cover your bases. So if a patient's allergic to something, you want to know that ahead of time. If the patient's had a bad interaction with a previous dentist, you want to know that because you want to know what not to do. If a patient just moved here from somewhere, it's nice to know small fun facts about them because you can just walk in the room and bring it up, and they appreciate you knowing them on a personal basis. And then finally, I follow up on any Invisalign cases. So I've been starting Invisalign lately, and it's great. I love Invisalign a lot, and that's another thing I think will be like a strong suit to have, especially with how it's growing in dentistry. So definitely consider that when you're in dental school and when you get out. So I know I'm jumping back and forth between stuff, but I had to re-edit some of this stuff last minute. Sorry about that. So again, back to my mental health rules. Take moments to congratulate yourself. This is something you guys can screenshot or save. Take breaks and vacations, treat yourself. Make sure that whenever you do have free time, take advantage of it. I know it's easy to like just veg out and play video games or watch movies, and that's fine. That's some way to treat yourself too, but also like go out and do stuff, because I think like we spend so much time inside and in the library and studying. I think it's important to like just get up and do something for yourself. The other thing is super important is just don't compete with people. Like it's not going to help you at all. Like I did it for the first like few years of like undergrad, and then in dental school I even tried it, and it's just toxic. Like it doesn't help you at all. It puts you through a lot of anxiety, and I know it's like hard, especially in our social media world. You're always comparing yourself to others. Just try to drive it in your head that it's just not going to help you. There's a certain level of competition, like as like a soccer player and an athlete, it's good to have some competition because it makes you want to push yourself. But if it's to the point where you're just constantly comparing yourself to other people, then I think that's not a healthy thing to do. The other thing is help thy dental neighbors. Just help anyone in dentistry. Like if somebody needs help and you can help them, just try it, because I think the problem with some other healthcare providers and professions is they're very like individualized. And I think the beauty of dentistry is it's a very communal profession. And I think that's beautiful. And I've really like grown to love that aspect of it, because I've met so many dentists that are now my mentors and friends, and just people that I even reach out to when I need help on patients. And I think the more you help others, the more you'll get, rewarded in more than just getting advice from them. Like you grow such a great relationship with dentists, you can get referrals from them, from patients. Like I have friends that text me now and are like, hey, like a dental friend in Chicago texts me and is like, hey, I have a friend in Austin that's coming to see you now. He needs like crowns and veneers. And it's like, now I'm getting a reward, obviously having a patient, and financially I'm getting a reward. And it's just from knowing another friend that I helped like years ago in dental school. So just kind of keep that in mind. Like try not to compete, try to help when you can, because, that'll definitely be more beneficial. Be social. That's 40% of dentistry. So dentistry is basically a lot of handwork, a lot of, book work and whatnot, but it's a lot of social interaction. So you really need to know how to talk to patients, how to align with patients' emotions, expectations, make them feel comfortable. And not only that, you have to like get along with other dentists. I think that's the only way you're only going to grow your practice by being a good, friendly person. And just keep that in mind. You can be a studious person and kind of keep to yourself all through dental school and make all A's. But once you get out there, the patient's not going to care what your dental school grades were. They're going to care if you're a good person, if you're friendly, if you're fun to talk to. Because if they're nervous, they're going to want somebody to make them feel at ease. And if you're not going to be able to do that, they're going to go to another dentist who might not be as good or as smart as you, but they know how to hold a conversation with that patient. So just keep that in mind. Again, surround yourself with people you love, including people, places, things, like pets and whatnot, because that's super important. Like I moved to Austin because I love Austin. I moved here because Like, I know that I could have lived in a smaller city and made, 5 times as much money, but that's not going to make me happy ultimately. So do things that you love, even if it's, you know, not going to reward you as much, or if you're going to have to like sacrifice a little bit more to do it. I think it's much more worth it in the long run. And that includes people. You don't want to be around toxic people, and you don't want to be around people that aren't willing to help you grow. So that's something to just keep in mind. And that's also special in dental school, because there's going to be gunners in dental school that don't want to share with you, and that's fine. Just learn who to kind of drive yourself towards, and kind of avoid other sorts. Okay, so this is a case I just did recently. It's nothing special. I'm not like this amazing oral surgeon or anything. I just had a patient who had a wisdom tooth that was bothering them, and they wanted to get it out. It was a 26-year-old male, super cool dude, lived in Austin. He's a construction worker. He had pain in his upper right. It was throbbing, unable to sleep. And so we took intraoral picture, and you can see he had some pretty heavy decay on his buccal aspect. And so we took a PA, bite wing, and we did take a pano. We had them from before. And as you can see, I didn't take too many pictures. This was like all very last minute, but you can, here, I don't know. Can you see my mouse moving? Yeah, okay. So you can see his root is pretty long right here. And I don't know if you can tell, but his sinus is right here. So I didn't really like worry about it too much. I was, kind of erring on the side of it should be okay. I was kind of naive. It was also my very first extraction at this office. So I think I got a little bit too cocky there. So I was like, okay, I'm going to go ahead and get this out because this guy's in pain. So just to kind of review with you guys, this is the extraction tools, like the main extraction tools. There's other stuff, obviously, but there's elevators and forceps. So those are the two main things you kind of go back and forth between. There's other stuff outside of it, but when you're doing an extraction, you definitely want these with you. So it wasn't 32. It was actually one. I put 32 because I'm an idiot. So I elevated the tooth out of the socket using one of these guys right here. So basically what you do is you kind of drive these in between the two teeth. And when you do that, you kind of rotate it and basically elevate it out of its socket. I'm sure you guys have seen YouTube videos and all that stuff. So when you're applying force like that, you're trying to break the PDL fibers and also kind of leverage the tooth out of the socket. So my oral surgeon, who was this badass Russian in dental school, always told me just like always use the elevator if you can. Like the forceps are only just for taking the tooth out when it's ready to come out. Like, it's completely loose and ready to come out. But the elevators are like your go-to instrument, which for me was like, I didn't appreciate that until I graduated. And now I realize like how important that is, because the forceps, as great as they are at like grabbing the tooth and, like moving it all, the problem with that is they're very technique sensitive to a certain extent, where if you don't hold the tooth at the right spot, or if you wiggle it too much or put too much force in a certain way, you can actually break the root. And once that happens, then you have a section of the tooth that's still in the socket. And then it's just a nightmare. You have to go through this whole like other process of getting the tooth out. It takes longer, wastes your appointment time, and it's not comfortable for the patient. So elevate as much as you can. When you do feel comfortable that the tooth is mobile enough, then grab the forceps and get it out. You can use the forceps to get like single rooted teeth out a lot easier, but with like multi-rooted teeth, you want to definitely elevate more and then use the forceps. So obviously different elevators serve different functions, different forceps apply to different teeth, and you'll learn that all in dental school. So we'll go over that later. So this is the procedure. So full disclosure, these aren't the pictures, but this is basically what it looked like. So I extracted the tooth using 2, 3, 4 millimeters. So I basically just went like bigger each time with the elevators. As they got wider, you just kind of give it more force and it loosens up over time. The purchase point is kind of like this point you get between the teeth where you can kind of hold onto it and anchor it, and then just start to kind of put some pressure on it. I rotated mesially, so you're kind of rotating in a counterclockwise to kind of think about it like a fulcrum. You're just trying to seesaw it out of there. So obviously the longer the root, the more challenge, just because you think about how much you have to get that root loose and get it out of there. So once the root did come out, obviously it definitely was in the sinus, but the good thing was the membrane was not broken. It was still intact. So this picture is actually of a membrane that is broken. So that hole is, and the sinus is in that area. So this is the membrane surrounding it. This is bone. So once that membrane is broken, if you ask like the patient to breathe or anything, this membrane is not going to really move because the air is just going in and out of the space, right? So when I did extract it, what I did was I held a mirror to kind of look at the membrane, and I cleared the area, and it's more like a bluish color. And if you ask the patient to breathe in through their nose and breathe out, you'll actually see this, it's kind of like a balloon. It just kind of like goes in and out. And that's when you can kind of tell that the membrane is still intact. So luckily mine was still intact. So what I did is I took a collagen plug and I just kind of plugged up the hole after cleaning the site. And the collagen membrane, what it does is basically, for me, it was the reason I put it in there was just to prevent anything from getting lodged in there or causing any issues down the road. So confirmed with breathing technique on patient, and then collagen plug placed and packed tight to avoid displacement. And then I followed it by the membrane. So I put a membrane over it again, because the membrane is basically like a kind of like a sheet you just put over. And that's that white thing right here. And that's, again, just to make sure the collagen doesn't fall out, doesn't get displaced, and nothing else goes inside there. So it kind of just protects everything, and it lets the healing process start. Obviously, the collagen promotes healing. Cross sutures were placed. So you can do different types of sutures. I think cross sutures were the best technique, and that's just a way to kind of keep everything in place, keep it tight, and also it helps with the healing, primary healing. Post-op instructions are given to patients, so it's definitely important to give post-op instructions no matter what type of extraction you're doing, but in this case it was especially important because I had to let them know what happened and also like what the precautions are. So like for his case, his precautions were just no smoking or drinking through a straw or anything to kind of build any pressure in that area, because obviously I don't want that to exacerbate anything. So yeah, that was the most complicated thing I had in the last 2 weeks, and everything turned out okay. He came in for post-op 2 weeks later, or a week later, totally fine, didn't feel anything. And yeah, it was great. Turned out great, and I'm thankful for that. Thankful for my Russian professor at dental school that I learned from with all this. So yeah, if you have a good professor in dental school, usually the strict ones, while they do suck in dental school for you, they are the best ones to have around. So just keep that in mind. The stricter they are, the more you're probably going to learn from them. So try to appreciate them as much as you can. Okay, the top reasons I chose, I already went over this. My advice is always keep a mentor around. You can never have too many, especially in dentistry. I have like a whole bunch, and to this day, like today, I already talked to 4 of them. So I always have a mentor. I always reach out. I'm never too like proud to ask someone to be my mentor or like reach out for help, because I realize, like, you know, dentistry, like they say, is a practice. You'll always be learning. Like you can never learn too much in dentistry. And I think like this whole like idea of being like too proud to admit it is just, you know, that's just old school train of thought. Just always be open. And if anything, you get a lot of friends, because it really like not only humbles you, but it really makes the other person feel good, because they realize like somebody respects and admires them that much to do that. So yeah, I guess the next thing is questions. So let's see. I don't know what I'm doing here. Does anybody have any?
Leave it on that slide.
Sorry?
You could just leave it on that slide, and then I'll just ask you the
Okay,
question.
cool.
So the first question was, why general dentistry? And did you ever think about specializing?
Yeah, I definitely wanted to specialize. I did want to become an oral surgeon because of this teacher in dental school. I considered it for a while, but then the drawback for me was the amount of school time. And that's not to deter anyone from it. I think it's definitely worth it. I think if you love it, it's worth doing. But I don't think I loved it enough to want to do that. And I really wanted to just jump into the field and do it. I just felt a lot of me was ready to start working, and I also loved the business aspect of it. And to be honest, I just wanted to travel too, and I felt like the longer I would be in school, the less I'd be able to do all those things. So the other thing is, I felt like if I ever did like doing something, I would always be able to do it. As a general dentist, you can do any of those specialties. You can take CE courses and learn how to place implants. You can do ortho. Like I'm doing ortho with Invisalign in a way. And I'm also doing a lot of cosmetic dentistry now. So I think like the beauty of general dentistry is you have the freedom to do all of that. Whereas those specialties, once you're in them, right? So you have to really love them. And so that was my deciding factor.
And then another question here was, what tips do you have to stay motivated throughout undergrad and the dental application process?
Um, I think motivation. So there's like, I forgot what the quote exactly is, but it's like inspiration comes from the outside, but motivation comes from the inside. So it's the only thing that helps you stay motivated is yourself. Like if you really want to do this, it's going to be pretty much natural, right? Like sure, you do need those like constant like reminders from people or things, but I think like inevitably consistency is what's going to get you there, right? So you just have to really train your mind to just always stay focused on the goal. And successful people like Michael Jordan, all those people, like they had a lot of detractors, a lot of reasons to not be where they are, but they didn't listen to those. They just focused on themselves and their attitude. And, that's why they're cocky in the way they are. It's because in their train of mind, it's only like what they're thinking that matters. So I guess like my best advice for that is just like believe in yourself and just be like that cocky mindset. Like, you're going to get there. It's just a matter of you focusing and staying consistent with it.
And then another question, what was it like working for your first practice helping lower income patients? What were the pros and cons?
So my first one was I actually worked at corporate for the first 6 months after I got out of dental school. And I did that because I was fresh out. I just needed to find a job. And I just kind of picked like one of the first corporate offices I came across that I like kind of agreed with their perspective on things. I ended up hating it. It was awful. I never want to work corporate again. I have my own like personal thoughts about corporate, but everybody's experience is different. So I'm not going to deter you from that. But I will say that read all your contracts when you get out of dental school. Make sure if you have a lawyer friend or if you can get a lawyer to read these contracts, just be very mindful of all that because corporations have been there for a long time with their practices, and so their contracts are very word heavy, and they know that dental school students can't read these. So it's smart to get somebody to read them. I didn't get, anything bad happen to me, but looking back, I can see how I could have easily been, in a bad state. Working at the lower income office was amazing. I really loved it. I think it's not only is it rewarding to be able to like help people who need it, but you get challenged in a different way. Like you have to learn how to really like hit the ground running, doing a lot of stuff you were never used to. Like I worked with kids a lot and I had never done pediatric dentistry in dental school. I saw maybe like 5 kids total in dental school. And then I went to an office in lower income where I was seeing like 15 to 20 kids a day. And it was awesome. Like, I mean, at first I was scared because you're working with these kids that are screaming and crying and all this stuff. And it is scary, but it's also great to know that you can help this kid who would probably never get any of this work done if they didn't come in your office. And it was a lot of learning how to also communicate with kids and interact with kids in a different way. So yeah, it was great. And I think if you get the opportunity to do that, definitely try it. Um, it's very tough and it's very challenging, but I think it's rewarding at the end of the day, and it's worth giving a shot.
Another question here regarding corporate dentistry. They say that no, it's the quick growing industry, especially for dentistry. So, how could we approach deciding between private and corporate?
I think everyone's different. Every dentist I know has a different mindset towards it, and every dentist has had a different experience towards it. Some have had great experiences, some have had horrible experiences, like me. Um, so it's all case dependent, and like I can't really tell you anything in that regard, but I do think that it's worth. I think it's worth exploring and researching into if you are interested in it. But just keep in mind that the beauty of dentistry is like the freedom of it, and I think that corporate, unfortunately, is starting to restrict that aspect of it, and that's what I really don't like. I'm very like hippie, free-minded, like do what you want, like treat people the way you want, talk to them the way you want, whereas corporate is trying to like structure everything, which I like don't like at all. So
And then, what would you say has been like the biggest hardship, I guess, on dentists and mental health?
um, I mean, definitely the student debt. The student debt sucks. It's not like something I'm a fan of. It's not something that should exist, but here we are in America dealing with that. And unfortunately, it's not getting any better. So like, I don't know where it'll be when you guys are at, but I think that's something to keep in mind and just also take into consideration when you're getting into all this is, do you want to be in that debt, and are you prepared for it? Because you really want to love this field, because you're not only are you getting into it for those reasons, but you have to take into consideration if that debt's worth it for you, because you want to pay it off and you want to be debt free at the end of the day. So I guess that's the one thing. I know that another thing is like physical toll it takes on people. Like if you don't practice right, if you don't have the right posture and all this other stuff, it's definitely not going to help you in the long run. So try to work on your posture from the start and try to be active and be in shape as much as you can, because it'll definitely help you so you're not walking around with a hunchback at the end of the day. So that's something to keep in mind. And mental health. I mean, I covered all that, so you guys are probably tired of hearing that, but just stay positive.
And then, do you feel like Midwestern prepared you for the business side of dentistry or running a practice, or do you feel like you're learning more from being in the field?
No, I don't think any dental school prepares you for the business aspect. Like, even if they give you like one class or two classes, it's not enough. Like, I wish we did get more, but I think at the end of the day, the best experience you get will firsthand experience. So when you do get out of dental school, you're going to have a lot of experiences that'll be the first time you're coming across it and stuff. And some companies are even geared to taking advantage of dentists because we're not business minded or we're not smart about that stuff. So just be very careful. Try to be responsible about your financial choices when you get out of dental school, because you go from making nothing to making like a decent amount of money. And I would say, try to teach yourself. Like I'm still teaching myself right now. Like I listen to the White Coat Investor podcast. I read financial help, self-help books. I think like the beauty of our profession is you're always learning, and that includes the business aspect of things. You want to be really smart about your money. And I think the only way you can do that is by teaching yourself. You can get a financial advisor, you can get an accountant, but it's also on you to be responsible about all that stuff.
And then another question, do you have any advice for the finance aspect, like because dental school is so expensive?
I don't. I mean, I'm not like a financial advisor. I'm not certified in any of that, so I don't think it would be responsible of me to give you any advice in that regard. All I will say is just try to be frugal when you are in dental school. Like you'll get loans and stuff and you'll think like, oh, this is like free money and it's like monopoly money, but it's like, you're going to be paying for that later on. So just try to borrow as little as you need, or like try to borrow the bare minimum and live off the bare minimum while you're in school, because um, interest sucks and it's going to build up on you, and you don't want that to kind of accumulate into something out of reach.
And then our last question for you is, what is your favorite procedure to perform?
Um, I used to love oral surgery a lot, like just doing like random stuff like cutting and all that whatnot. I think I like have some sadistic stuff built in me, but I definitely love cosmetic aspects of dentistry now. And I'm recently really getting into Invisalign because I took an amazing course with this guy named Dr. Galler, and he's like one of the highest regarded Invisalign providers. And I got to learn about like the mechanisms behind Invisalign and how it works. And I just think that whole aspect of it is amazing, because I learned about like the aspects of occlusion and how important occlusion is in our dental oral health. And that's something in dental school that we don't learn a lot about, which is unfortunate, because occlusion plays such a big role in your overall health. And so if it's uneven on one side versus the other, it can cause tooth pain, it can cause recession, it can cause all this other stuff. So I think it's awesome. And yeah, obviously I guess that is my um, passion right now. But I think it's beautiful because in dentistry, your passion can sway between just different aspects of dentistry. So like right now, it's Invisalign and that aspect of it. But like last year, I really loved pediatric dentistry because I loved like working with kids and stuff. So like it can constantly change.
All right, well, thank you so much, Dr. Gosh. Guys, that's going to conclude our session today. The post-session quiz link is in the chat for you guys and also in the description below.